All right, I'll expand the Nimesulide information in full pharmacology detail so it's comprehensive for study and clinical reference. Nimesulide, complete drug monograph. 1. Generic name, drug class, brand names. Generic name, Nimesulide. Drug class, nonsteroidal anti-inflammatory drug, NSAID. Preferential COX-2 inhibitor. Pharmacological group, analgesic, antipyretic, anti-inflammatory. ATC code, M01AX17. Common brand names, India and Asia. Nimesulide, Nisip Europe, some countries, Nimesulide, Alin, Latin America, Nimesulide, Nimesul. Note, market availability differs due to legal restrictions. Nimesulide is a synthetic NSAID used for the short-term management of pain, inflammation, and fever. It is known for its selective inhibition of COX-2, which reduces prostaglandin synthesis involved in pain and inflammation, while sparing COX-1 to some extent, reducing gastric side effects compared to older NSAIDs. However, its clinical use is controversial because it can cause serious hepatotoxicity in rare cases, which has led to bans or restrictions in countries like the USA, UK, and Australia. Number 3. Mechanism of action. Primary action inhibits cyclooxygenase 2, COX-2, prostaglandin synthesis, pain, inflammation, fever. Secondary actions. Reduces release of free radicals from neutrophils. Inhibits tumor necrosis factor alpha TNF-8 release. Decreases histamine release from mast cells. Result, analgesic effect, reduce pain perception. Antipyretic effect, acts on hypothalamus to lower body temperature. Anti-inflammatory effect, reduces swelling and tissue damage. Number 4, uses, always under medical supervision in short term. Acute musculoskeletal pain, postoperative pain, dental pain, dysmenorrhea, menstrual cramps, osteoarthritis flare-ups, sports injuries, sprains, strains, fever when other antipyretics are unsuitable. 5. Indications. Acute inflammatory conditions of the joints, tendons, and ligaments, soft tissue injuries, pain and swelling after trauma or surgery, primary dysmenorrhea, fever associated with inflammation. 6. Contraindications. Absolute contraindications, hypersensitivity to Nimesulide or other NSAIDs, active peptic ulcer or gastrointestinal bleeding, severe hepatic impairment or active liver disease, severe renal impairment, creatinine clearance 30 millinits per min, severe heart failure, children under 12 years, pregnancy, especially third trimester, and lactation, history of NSAID-induced bronchospasm, urticaria, or rhinitis. Relative contraindications, use with caution, mild to moderate renal impairment, cardiovascular disease, history of alcoholism, concurrent hepatotoxic drug use. 7. Precautions before taking. Perform liver function tests before and during therapy if prolonged. Avoid in patients with past drug-induced liver injury. Use cautiously in elderly due to higher risk of GI and cardiovascular events. Avoid alcohol and other hepatotoxic drugs during treatment. If patient has high blood pressure or heart disease, monitor for fluid retention and worsening of cardiac function. Use the lowest effective dose for the shortest possible duration. How to use. Take after meals to minimize gastric irritation. Swallow tablets with a full glass of water. Do not crush unless directed. Do not exceed prescribed duration, usually 15 days. Avoid taking on an empty stomach or with alcohol. 9. Dosing information adults. Typical dose, 100 milligrams orally twice daily every 12 hours. Maximum daily dose, 200 milligrams. Duration, use for the shortest time possible, 15 days. Children, not recommended under 12 years. In some countries, 12 to 18 years also restricted. Elderly, same adult dose, but start at lower end of range if possible. Monitor closely. Number 10. Missed dose, overdose. Missed dose, take as soon as remembered unless it's near the time for the next dose. Never double up doses. Overdose symptoms, nausea, vomiting, drowsiness, lethargy, gastrointestinal bleeding, acute liver failure, hypotension, respiratory depression, rare, severe. Management, immediate gastric lavage if recent ingestion, activated charcoal administration, supportive treatment, no specific antidote. 11. Stop or avoid taking if signs of liver injury, yellowing of skin, eyes, jaundice, dark urine, persistent nausea, vomiting, severe abdominal pain or blood and stool vomit, allergic reaction, rash, swelling, breathing difficulty, unexplained fever or flu-like symptoms during use. 12. Side effects. Common 1 to 10%, nausea, vomiting, abdominal discomfort, diarrhea, dizziness, headache, heartburn. Uncommon 1%, edema, rash, pruritus, increased liver enzymes. Serious 0.1% but critical, hepatitis, fulminant hepatic failure, GI bleeding, peptic ulcer perforation, Stevens-Johnson syndrome, toxic epidermal necrolysis, anaphylaxis. Number 13, vital information. Legal status varies. Banned in USA, UK, Australia, Canada due to hepatotoxicity risk. Allowed under restrictions in India, some EU countries, parts of Asia, and South America. Key safety principle. Use only when benefits outweigh risks, at the lowest effective dose, and for the shortest duration. Monitor liver function if used beyond a few days. Number 14, drug interactions. Increased toxicity risk with other NSAIDs, ibuprofen, diclofenac, aspirin, GI bleeding, ulcer, anticoagulants, warfarin, heparin, bleeding, antiplatelets, clopidogrel, bleeding, corticosteroids, prednisolone, GI ulcer risk, methotrexate, toxicity, cyclosporin, tacrolimus, nephrotoxicity, SSRIs, fluoxetine, sertraline, GI bleeding, alcohol, hepatotoxicity. Metabolism, primarily hepatic via CYP2C9. Drugs affecting this enzyme may alter plasma levels. Thank you. Have a nice day.